Hi, welcome back to Dr.OBT's podcast, and I think I'm getting some questions today. So, yeah. PRP, I believe, is one of my favorite regenerative treatments. So you have your own PRP. So it's derived from your own plasma. So when you take it, it's like harvested just the way you give a normal blood test. And we centrifuge it, we separate the plasma. And that plasma is enriched with growth factors. Those growth factors enable you to have a natural solution to improving skin health and scalp health. PRP is being used in medicine and many other disciplines as well, such for wound healing and wound repair as well. In my practice, I'm using it for skin rejuvenations and for improving scarring, improving wrinkling, improving under eye circles, improving wrinkles, necklines, and I also believe it'll work anywhere I inject in the body, because it's going to nourish and provide amazing growth factors to actually help improve the tissue quality. When I'm using it for hair loss, it actually starts working in such a way that your hair loss is reduced. You don't lose as much hair as before, and then you start noticing a healthier, stronger regrowth of hair after a few sessions. It's something regenerative medicine requires a bit of patience. So most of my patients are more happy after a few sessions, and then there's a treatment phase in the first year, and then there is a maintenance phase. So if you want a quick fix, PRP is not for you. But if you want to do something for yourself so that you have a much more healthier hair and skin in the future, and something which is a natural treatment, I think PRP is the best. Thanks. After acne, we can get either PIH, which is post-inflammatory hyperpigmentation, or we can get PIE, which is post-inflammatory erythema. And erythema means that redness which remains for a while after acne has resolved. So it depends really how you've treated the acne. If you have undergone a proper treatment, a medical solution for acne, as well as medical treatments for acne, or aesthetic medical treatments for acne, then of course that redness will take time to go away, but we can do things to hasten the recovery. Number one is using a good quality sunscreen, one which is not oily, so that you don't develop further acne. Secondly, you should be using something like niacinamide, which is really good for pore health. Thirdly, you can be using things like one of my favorites is the gold light therapy and LED, blue LED. These are very healing, and they really improve people who've had acne and are currently even having acne, because it will help to shrink the vessels, the inflammation, and thereby your redness will reduce. Then you should also be thinking of the regenerative therapies such as microneedling to actually come back, and once acne has resolved, to actually help tighten the pores, improve the pore size, improve the scarring, and actually bring a flood of new collagen so that your skin health is restored. You have to understand that melasma will require patience. We can help you improve melasma, but it does take some time. It can take anywhere between 6 months, 10 months, or over a year to treat melasma. And once it's treated, once you've achieved a result, which realistically speaking could be around 70% or 80% maximum, then you also have to work hard to maintain those results so that it doesn't get worse again. So you have to understand that there are multiple treatment options available for melasma, but you should be going to somebody who has experience in treating with it, because if you're using treatments which are going to deliver too much heat to the skin, and having a lifestyle in which you are out in the sun a lot and getting a lot of exposure, or even cooking in front of a lot of heat, it's not going to help you. So you really have to really protect your skin in your day-to-day life, and then you have to commit to a plan. So whether it's a mesotherapy or whatever, I believe that multiple treatments when you are combining them safely and your doctor has experience in them, that's probably going to give you a better result. So home skincare, which means avoidance of sunlight and the appropriate night creams and serums, and then the treatment plan, which is probably combination treatments, which you should be doing with a space in between the sessions. That's, in my opinion, that works the best for melasma. Damaged or lost a bit of collagen in your skin, and that's why you're left with those little indentations and scarring. So basically you have to be very patient, because we're trying to build collagen and restore the skin's health to make your skin look better. So you have to be very, very patient, and generally my patients are happier midway through my treatment protocol. It can take me anywhere between 6 months to a year to treat acne, and in that I'm using a combination of treatments: direct excision of the acne scar. There could be subcision in which I break up the scar from underneath. There could be PRP or exosomes used. There could be RF microneedling. There could be carbon dioxide laser. There could be peels. There could be a combination. So it's a lot of treatments, but everybody is very unique. So you should always leave it to the practitioner who's treating you, so that he or she knows exactly what kind of acne you have and which one will respond to the right treatment. So patience is key. Thanks. So basically, yes, androgenic alopecia is something which affects a lot of males and some females as well. I think it's very important to first get a proper blood test investigation to rule out any hormonal issues, any thyroid disorders, and deficiencies in your blood. Could be vitamin D, could be your own hemoglobin. So please don't underestimate the importance of a proper diagnosis, a proper blood test, and speak to your doctor about your gynecological issues or your other issues, medical issues, because they could also be playing a factor in your hair loss. Once the diagnosis has been made, you have to be very careful, because things like finasteride are good for males primarily, and pregnant females should not be exposed to this drug. It actually was a drug created to treat prostate enlargement for men, but they found out that it really works good for hair regrowth. So in very selected males, I do offer it. I give it to them in addition to any other topical sprays as well. Regarding natural therapies, I think that Procapil is a good formula, equivalent in strength, in efficacy, to minoxidil. So it's something which you need to be using regularly for better results, along with the appropriate supplementation, and sometimes even an addition of treatments such as PRP or exosomes to really give you the best results. Thank you.